Question 1. A 26-year-old G2P1 client at 39 weeks gestation is in active labor. The nurse is caring for 4 clients simultaneously. Which client should the nurse assess first? A. A client at 7 cm dilation requesting pain medication, rating pain 9/10. B. A client with ruptured membranes reporting a sudden gush of fluid and feeling something in the vagina. C. A client at 5 cm dilation with regular contractions every 4 minutes. D. A client at 8 cm dilation who is nauseated and vomiting. Answer. B. A client with ruptured membranes reporting a sudden gush of fluid and feeling something in the vagina. Rationale. This suggests possible umbilical cord prolapse, a life-threatening emergency requiring immediate intervention to prevent fetal hypoxia. This takes priority over pain, normal labor progression, or expected symptoms like nausea. Question 2. A laboring client at 40 weeks gestation has the following fetal heart rate, FHR, tracings. Which finding requires immediate intervention? A. Baseline FHR 140 bpm with moderate variability. B. Early decelerations with contractions. C. Variable decelerations with quick recovery. D. Late decelerations with minimal variability. Answer. D. Late decelerations with minimal variability. Rationale. Late decelerations indicate uteroplacental insufficiency, and minimal variability suggests worsening fetal hypoxia. Immediate action, position change, oxygen, for fluids, is required to improve fetal oxygenation. Question 3. The nurse is monitoring a client receiving oxytocin infusion for labor induction. Which finding requires the nurse's priority action? A. Contractions every 3 minutes lasting 60 seconds. B. FHR baseline 135 bpm. C. Uterine resting tone of 25 mm of mercury. D. Contractions every 2 minutes lasting 100 seconds. Answer. D. Contractions every 2 minutes lasting 100 seconds. Rationale. This indicates uterine tachysystole, which can reduce placental perfusion and cause fetal distress. The nurse must stop oxytocin immediately. Question 4. A postpartum client 1 hour after vaginal delivery has a boggy uterus and heavy vaginal bleeding. What is the nurse's first action? A. Administer oxytocin. B. Massage the fundus. C. Increase 4 fluids. D. Call the healthcare provider. Answer. B. Massage the fundus. Rationale. A boggy uterus indicates uterine atony, the most common cause of postpartum hemorrhage. Fundal massage is the immediate first intervention to stimulate contraction. Question 5. A laboring client suddenly reports severe abdominal pain, cessation of contractions, and fetal distress. What is the nurse's priority action? A. Administer analgesics. B. Notify the provider and prepare for emergency surgery. C. Reposition the client. D. Increase 4 fluids. Answer. B. Notify the provider and prepare for emergency surgery. Rationale. These findings suggest uterine rupture, a catastrophic emergency requiring immediate surgical intervention. Question 6. A client in labor has ruptured membranes with greenish amniotic fluid. What is the nurse's priority concern? A. Maternal infection. B. Fetal distress due to meconium aspiration. C. Prolonged labor. D. Maternal dehydration. Answer. B. Fetal distress due to meconium aspiration. Rationale. Green fluid indicates meconium-stained amniotic fluid, which increases risk of fetal aspiration and respiratory complications. Question 7. A client receiving magnesium sulfate for preeclampsia has the following assessment findings. Which requires immediate intervention? A. Respiratory rate 10 breaths/min. B. Urine output 40 milliliters per hour. C. Deep tendon reflexes 2+. D. Blood pressure 150/90 mmHg. Answer. A. Respiratory rate 10 breaths/min. Rationale: magnesium sulfate toxicity can cause respiratory depression. A rate less than 12 is dangerous and requires stopping the infusion and administering calcium gluconate. Question 8. A client at 38 weeks gestation presents with painless vaginal bleeding. What is the nurse's priority action? A. Perform a vaginal exam. B. Monitor contractions. C. Prepare for ultrasound evaluation. D. Encourage ambulation. Answer. C. Prepare for ultrasound evaluation. Rationale: painless bleeding suggests placenta previa. Vaginal exams are contraindicated due to risk of hemorrhage. Ultrasound confirms diagnosis. Question 9. A laboring client's FHR shows recurrent variable decelerations. What is the nurse's first intervention? A. Administer oxygen. B. Reposition the client. C. Increase oxytocin infusion. D. Prepare for cesarean delivery. Answer. B. Reposition the client. Rationale: variable decelerations are caused by cord compression. Repositioning relieves pressure and is the first-line intervention. Question 10. A postpartum client reports severe perineal pain and pressure. The nurse notes a firm uterus and minimal bleeding. What is the nurse's priority action? A. Administer analgesics. B. Apply ice pack. C. Assess for hematoma. D. Encourage ambulation. Answer. C. Assess for hematoma. Rationale: severe pain with minimal bleeding and firm uterus suggests a hematoma, which can lead to significant internal blood loss. Question 11. A nurse is caring for 4 laboring clients. Which client should the nurse assess first? A. A client at 6 cm dilation with increasing rectal pressure. B. A client at 4 cm dilation requesting epidural anesthesia. C. A client with oxytocin infusion and recurrent late decelerations. D. A client at 5 cm dilation with contractions every 5 minutes. Answer. C. A client with oxytocin infusion and recurrent late decelerations. Rationale: late decelerations indicate fetal hypoxia. The presence of oxytocin increases uterine activity, worsening oxygen compromise. Immediate intervention is required to prevent fetal distress. Question 12. A client in labor suddenly develops shortness of breath, chest pain, and cyanosis. What is the nurse's priority action? A. Place the client in Trendelenburg position. B. Administer oxygen and call rapid response. C. Increase 4 fluids. D. Monitor fetal heart rate. Answer. B. Administer oxygen and call rapid response. Rationale: these symptoms suggest amniotic fluid embolism, a life-threatening emergency requiring immediate oxygenation and advanced support. Question 13. A nurse notes a fetal heart rate of 90 bpm lasting for 3 minutes during labor. What is the nurse's priority action? A. Continue monitoring. B. Document findings. C. Reposition the client and administer oxygen. D. Prepare discharge teaching. Answer. C. Reposition the client and administer oxygen. Rationale: prolonged fetal bradycardia indicates fetal distress. Immediate interventions are needed to improve oxygen delivery. Question 14. A client receiving epidural anesthesia becomes hypotensive. What is the nurse's first action? A. Administer vasopressor. B. Increase 4 fluid rate. C. Reposition to left lateral position. D. Assess fetal heart rate. Answer. C. Reposition to left lateral position. Rationale: epidural-induced hypotension reduces placental perfusion. Left lateral positioning improves venous return and uteroplacental blood flow. Question 15. A nurse is assessing a postpartum client with continuous trickling of blood and a firm uterus. What is the priority concern? A. Uterine atony. B. Laceration of the birth canal. C. Retained placenta. D. Infection. Answer. B. Laceration of the birth canal. Rationale: a firm uterus with ongoing bleeding suggests trauma, e.g., laceration, not uterine atony. Question 16. A client at 32 weeks gestation presents with severe abdominal pain and dark vaginal bleeding. What is the nurse's priority action? A. Perform vaginal exam. B. Prepare for emergency delivery. C. Monitor fetal movement. D. Encourage hydration. Answer. B. Prepare for emergency delivery. Rationale: these signs indicate placental abruption, a life-threatening emergency requiring rapid delivery to prevent maternal and fetal death. Question 17. A nurse observes tachysystole in a client receiving oxytocin. What is the first action? A. Increase oxytocin dose. B. Stop oxytocin infusion. C. Administer pain medication. D. Notify family. Answer. B. Stop oxytocin infusion. Rationale: tachysystole reduces fetal oxygenation. Immediate discontinuation of oxytocin is critical. Question 18. A newborn is delivered and is limp with a heart rate of 80 bpm. What is the nurse's priority action? A. Dry and stimulate the newborn. B. Begin chest compressions. C. Provide positive pressure ventilation. D. Administer oxygen via mask. Answer. C. Provide positive pressure ventilation. Rationale: a heart rate less than 100 indicates need for ventilatory support. PPV is the priority intervention per neonatal resuscitation guidelines. Question 19. A client in labor reports sudden sharp pelvic pain and a tearing sensation. FHR becomes non-reassuring. What is the nurse's priority action? A. Administer analgesics. B. Prepare for cesarean delivery. C. Reposition the client. D. Monitor contractions. Answer. B. Prepare for cesarean delivery. Rationale: this suggests uterine rupture, requiring immediate surgical intervention to save mother and fetus. Question 20. A client with preeclampsia reports headache, blurred vision, and epigastric pain. What is the nurse's priority action? A. Administer antihypertensive medication. B. Place client in a dark, quiet room. C. Assess for seizure activity and prepare magnesium sulfate. D. Encourage oral fluids. Answer. C. Assess for seizure activity and prepare magnesium sulfate. Rationale: these are signs of impending eclampsia. Seizure prevention with magnesium sulfate is the priority. Question 21. A nurse is caring for 4 postpartum clients. Which client should the nurse assess first? A. A client 2 hours postpartum with fundus firm at the umbilicus. B. A client reporting chills and temperature of 38 degrees Celsius 100.4 degrees Fahrenheit. C. A client saturating a perineal pad in 10 minutes. D. A client complaining of afterpains during breastfeeding. Answer. C. A client saturating a perineal pad in 10 minutes. Rationale: this indicates postpartum hemorrhage, a life-threatening emergency requiring immediate intervention. Question 22. A laboring client's fetal heart tracing shows absent variability. What is the nurse's priority action? A. Continue monitoring. B. Notify provider immediately. C. Reposition and administer oxygen. D. Encourage pushing. Answer. C. Reposition and administer oxygen. Rationale: absent variability indicates severe fetal compromise. Immediate intrauterine resuscitation is required before escalation. Question 23. A nurse notes that a laboring client's contraction pattern shows 6 contractions in 10 minutes. What is the priority intervention? A. Continue monitoring. B. Increase oxytocin infusion. C. Stop oxytocin infusion. D. Encourage ambulation. Answer. C. Stop oxytocin infusion. Rationale: this indicates uterine tachysystole, which compromises fetal oxygenation. Question 24. A postpartum client develops sudden shortness of breath and chest pain. What is the nurse's priority action? A. Administer pain medication. B. Encourage deep breathing. C. Call rapid response and administer oxygen. D. Assess uterine tone. Answer. C. Call rapid response and administer oxygen. Rationale: these symptoms suggest pulmonary embolism, a life-threatening emergency requiring immediate intervention. Question 25. A nurse is caring for a client in the second stage of labor. The fetal head is crowning, but the fetal heart rate drops to 70 bpm. What is the nurse's priority action? A. Continue to encourage pushing. B. Apply oxygen and prepare for assisted delivery. C. Stop pushing immediately. D. Reposition client. Answer. B. Apply oxygen and prepare for assisted delivery. Rationale: severe bradycardia during crowning indicates acute fetal distress. Rapid delivery is required. Question 26. A client with ruptured membranes has a sudden drop in fetal heart rate to 80 bpm. What is the nurse's priority action? A. Reposition the client. B. Perform a vaginal exam to check for cord prolapse. C. Administer 4 fluids. D. Apply oxygen. Answer. B. Perform a vaginal exam to check for cord prolapse. Rationale: sudden bradycardia after rupture suggests cord prolapse, requiring immediate confirmation and intervention. Question 27. A nurse is caring for a client receiving magnesium sulfate. Which finding requires immediate action? A. Urine output 25 ml per hour. B. Respiratory rate 14 per minute. C. Blood pressure 140/90 mmHg. D. Reflexes 2+. Answer. A. Urine output 25 ml per hour. Rationale: low urine output increases risk of magnesium toxicity due to reduced excretion. Question 28. A client at 37 weeks gestation presents with severe headache and BP 170/110 mmHg. What is the nurse's priority action? A. Encourage rest. B. Administer antihypertensive and magnesium sulfate. C. Monitor fetal movement. D. Provide oral fluids. Answer. B. Administer antihypertensive and magnesium sulfate. Rationale: this indicates severe preeclampsia, requiring immediate seizure prevention and BP control. Question 29. A postpartum client reports calf pain and swelling. What is the nurse's priority action? A. Massage the leg. B. Encourage ambulation. C. Assess for deep vein thrombosis and notify provider. D. Apply heat. Answer. C. Assess for deep vein thrombosis and notify provider. Rationale: symptoms suggest DVT, which can lead to pulmonary embolism if untreated. Question 30. A nurse is monitoring a laboring client whose fetal heart tracing shows recurrent late decelerations despite interventions. What is the nurse's next priority action? A. Continue observation. B. Increase 4 fluids. C. Prepare for emergency cesarean delivery. D. Encourage pushing. Answer. C. Prepare for emergency cesarean delivery. Rationale: Persistent late decelerations indicate ongoing fetal hypoxia unresponsive to interventions, requiring immediate delivery. Question 31. A nurse is caring for 4 clients in labor. Which client should the nurse assess first? A. A client at 9 cm dilation with urge to push. B. A client with epidural reporting itching and mild hypotension. C. A client with ruptured membranes and fetal heart rate of 100 bpm. D. A client at 6 cm dilation requesting position change. Answer. C. A client with ruptured membranes and fetal heart rate of 100 bpm. Rationale. A fetal heart rate of 100 bpm indicates bradycardia, suggesting fetal hypoxia. Immediate assessment is required. Question 32. A postpartum client has a firm uterus but continues to have heavy vaginal bleeding. What is the nurse's priority action? A. Massage the fundus. B. Administer oxytocin. C. Inspect for lacerations. D. Encourage breastfeeding. Answer. C. Inspect for lacerations. Rationale. A firm uterus with heavy bleeding indicates trauma, laceration, rather than uterine atony. Question 33. A nurse notes recurrent variable decelerations in a laboring client. Which intervention should be implemented first? A. Administer oxygen. B. Increase 4 fluids. C. Reposition the client. D. Prepare for cesarean delivery. Answer. C. Reposition the client. Rationale. Variable decelerations are caused by cord compression, and repositioning relieves pressure. Question 34. A client receiving oxytocin develops uterine tachysystole with fetal distress. What is the nurse's priority action? A. Continue infusion. B. Stop oxytocin and administer oxygen. C. Increase 4 rate. D. Document findings. Answer. B. Stop oxytocin and administer oxygen. Rationale. Tachysystole reduces placental perfusion, stopping oxytocin is the priority. Question 35. A client in labor suddenly complains of severe chest pain and shortness of breath. What is the nurse's priority action? A. Monitor contractions. B. Place in supine position. C. Administer oxygen and call rapid response. D. Provide reassurance. Answer. C. Administer oxygen and call rapid response. Rationale. Symptoms suggest amniotic fluid embolism or pulmonary embolism, both life-threatening. Question 36. A nurse is assessing a newborn immediately after birth. Which finding requires immediate intervention? A. Heart rate 120 bpm. B. Weak cry and poor muscle tone. C. Pink body with blue extremities. D. Respiratory rate 45 per minute. Answer. B. Weak cry and poor muscle tone. Rationale. Indicates respiratory depression or poor adaptation, requiring immediate support. Question 37. A client with severe preeclampsia begins to seize. What is the nurse's first action? A. Restrain the client. B. Insert oral airway. C. Turn client aside and protect airway. D. Administer antihypertensives. Answer. C. Turn client aside and protect airway. Rationale. During a seizure, airway protection and injury prevention are the priority. Question 38. A postpartum client has a boggy uterus displaced to the right. What is the nurse's priority action? A. Massage the fundus. B. Assist the client to void. C. Administer oxytocin. D. Call provider. Answer. B. Assist the client to void. Rationale. A displaced uterus indicates a full bladder, which prevents contraction and increases bleeding risk. Question 39. A laboring client's fetal heart tracing shows minimal variability. What is the nurse's priority action? A. Continue monitoring. B. Reposition and administer oxygen. C. Encourage pushing. D. Document findings. Answer. B. Reposition and administer oxygen. Rationale. Minimal variability suggests decreased fetal oxygenation, requiring immediate intervention. Question 40. A nurse is caring for a client with suspected placental abruption. Which finding supports this diagnosis? A. Painless vaginal bleeding. B. Bright red bleeding. C. Severe abdominal pain with rigid uterus. D. No contractions. Answer. C. Severe abdominal pain with rigid uterus. Rationale. Placental abruption presents with painful bleeding and uterine rigidity due to concealed hemorrhage. Question 41. A nurse is caring for 4 postpartum clients. Which client should the nurse assess first? A. A client with temperature 38.2 degrees Celsius 100.8 degrees Fahrenheit 24 hours after delivery. B. A client with a firm fundus and moderate lochia. C. A client reporting sudden dizziness and saturating a pad every 15 minutes. D. A client complaining of breast engorgement. Answer. C. A client reporting sudden dizziness and saturating a pad every 15 minutes. Rationale. This indicates postpartum hemorrhage with possible hypovolemia, a life-threatening emergency requiring immediate intervention. Question 42. A laboring client's fetal heart tracing shows prolonged deceleration lasting 4 minutes. What is the nurse's priority action? A. Continue monitoring. B. Reposition and administer oxygen. C. Document findings. D. Encourage pushing. Answer. B. Reposition and administer oxygen. Rationale. A prolonged deceleration indicates significant fetal hypoxia, requiring immediate intrauterine resuscitation. Question 43. A client receiving magnesium sulfate becomes lethargic with absent deep tendon reflexes. What is the nurse's priority action? A. Continue monitoring. B. Administer calcium gluconate. C. Increase 4 fluids. D. Check blood pressure. Answer. B. Administer calcium gluconate. Rationale. These are signs of magnesium toxicity, and calcium gluconate is the antidote. Question 44. A nurse notes that a laboring client's contractions have stopped suddenly, followed by fetal distress and abdominal pain. What is the nurse's priority action? A. Reposition the client. B. Prepare for emergency cesarean delivery. C. Administer analgesics. D. Encourage pushing. Answer. B. Prepare for emergency cesarean delivery. Rationale. This suggests uterine rupture, requiring immediate surgical intervention. Question 45. A client at 36 weeks gestation presents with painless vaginal bleeding. What is the nurse's priority action? A. Perform vaginal exam. B. Prepare for ultrasound. C. Monitor contractions. D. Encourage ambulation. Answer. B. Prepare for ultrasound. Rationale. Suspected placenta previa requires confirmation via ultrasound. Vaginal exams are contraindicated. Question 46. A newborn has a heart rate of 60 bpm after initial stimulation. What is the nurse's priority action? A. Continue stimulation. B. Provide positive pressure ventilation. C. Begin chest compressions. D. Administer oxygen. Answer. B. Provide positive pressure ventilation. Rationale. If a newborn is gasping, apneic, or has a heart rate below 100 bpm after the initial steps, warming, drying, and stimulating, the most important and effective action is to assist ventilation. Respiratory origin. Most neonatal bradycardia, low heart rate, is caused by respiratory failure and a lack of gas exchange. Effective ventilation. Providing PPV helps expand the lungs and clear fetal lung fluid, which usually leads to a rapid increase in heart rate. Timeline. PPV should be started within the first 60 seconds, the golden minute, of life if the heart rate remains below 100 bpm. Question 47. A laboring client develops uterine tachysystole with minimal fetal heart variability. What is the nurse's priority action? A. Continue oxytocin. B. Stop oxytocin and reposition. C. Encourage pushing. D. Document findings. Answer. B. Stop oxytocin and reposition. Rationale. Tachysystole combined with decreased variability indicates fetal compromise, requiring immediate intervention. Question 48. A postpartum client complains of severe headache and visual disturbances. What is the nurse's priority action? A. Administer analgesics. B. Monitor vital signs. C. Assess for postpartum preeclampsia and notify provider. D. Encourage rest. Answer. C. Assess for postpartum preeclampsia and notify provider. Rationale. These symptoms suggest postpartum preeclampsia, which can progress to seizures if untreated. Question 49. A nurse notes that the umbilical cord is protruding from the vagina after membrane rupture. What is the nurse's priority action? A. Push the cord back inside. B. Place client in knee-chest position and call for help. C. Administer oxygen only. D. Prepare for discharge. Answer. B. Place client in knee-chest position and call for help. Rationale. This is umbilical cord prolapse. Positioning relieves pressure on the cord while preparing for emergency delivery. Question 50. A laboring client's fetal heart tracing shows persistent late decelerations with absent variability despite interventions. What is the nurse's priority action? A. Continue monitoring. B. Increase 4 fluids. C. Prepare for immediate cesarean delivery. D. Reposition client again. Answer. C. Prepare for immediate cesarean delivery. Rationale. Persistent non-reassuring patterns indicate severe fetal hypoxia, requiring urgent delivery to prevent fetal demise.
If these questions challenged your clinical judgment, you're thinking at the level the Nclex demands. Prioritization in labor and delivery isn't about memorization. It's about recognizing subtle danger signs before they become catastrophic. Keep sharpening your instincts, because in real practice, seconds matter and decisions save lives.